Karli, thank you so much for coming back. I've just looked the last time we spoke, and some viewers with long-term memories might remember, but it was the 22nd of May. So it seems a bit of a lifetime ago now, doesn't it? But first of all, tell us, how have you been health-wise?
I've been okay this year. I think the restrictions have really helped keep any colds at bay. I haven't had any illnesses this year. I will say mentally, though, pretty exhausted.
Just remind us where you are geographically, Karli.
In the Pacific Northwest in the state of Oregon.
Yeah,
Oregon
yeah.
is between Washington and California, and it's nothing but gray and rain right now.
Is
So,
it? What's the
we,
temperature there now?
oh, in the 40s. We haven't had too
Yeah.
many cold nights. I don't even know if it's dropped below freezing yet. So it's
It
another.
is here. I'm in the north of England. It is so cold the last couple of days. It really makes it hard to keep things ventilated. And you've got a high risk occupation in terms of COVID disease, Karli. What do you do?
Yeah, I'm a cardiac nurse for one of the hospitals here in the area. So
Hmm.
I've been a nurse
Okay.
for many years, and I'd say that this year in particular has probably been my most difficult personally and professionally.
Okay. What do you want to tell us about that? I mean, what's been difficult?
Well, you know, the pandemic has really shifted the way that nurses are able to provide care to their patients and
Mm.
families. And I think that has come at a price. I think that, we were trained to be the patient's, advocate, and we still are. Um, we've adapted to the changes, rightfully so, in order to provide safe care to our patients. But this has come at a price. I'm starting to see colleagues, really good nurses, leave the bedside now and or choose to retire early. The emotional stress for some just doesn't seem sustainable. And we've done our best. I think we're stronger in some ways than we ever have been as a nursing force. I think that this pandemic has really prepared us to be able to face other challenges in the future. But I think in terms of when you think about a pandemic and all that 2020 has brought with it, it's not like a catastrophe where we had an earthquake, we picked up the pieces and we moved on. It's been this long, long leg, and we've had great support within our local government, our state government, and our hospitals working in conjunction with our local government, but we haven't had the same level of support coming from our federal government and leaders. And it's been felt very divisive. And we are at the bedside every day wearing those masks and the face shields and providing safe care. And it's really hard sometimes to look around and see others that don't, and their choices directly impact so many lives around them. And whether or not you are in the hospital and you can see that, it is still happening. And I wish that I could give everyone a window into what it's like, and I can't. But yeah,
I
it's
mean, we're
been a
really
tough
talking
year.
about the politicization of basic healthcare precaution and restrictions. It's kind of hard for an outsider to understand that, but it's obviously your lived experience, this, Karli, isn't it?
Yeah, and it didn't ever have to become political,
Yeah.
and I'm sorry that it ever did.
Yeah.
I've looked at other countries. My husband is Australian, and it's funny to think that this time last year, his parents were here visiting us. He's their only son, and their family means a lot to us. And we try to get there once a year down to Australia, or they
Mm.
come here once a year.
Mm.
And just watching the way in which Australia has had such a unified and decisive,
Yeah.
effort in nipping outbreaks in the bud.
Yeah.
It's been hard to see how it's turned out here. It didn't have to be this way.
Do you have the expression like chalk and cheese in the States? It just
Yeah,
just couldn't be more different, could it?
Yeah.
Yeah.
You know, we've worked hard to follow the mandates for the protection of our patients and families, and it comes down to individuals' choices. Even with our local mandates that have been pretty well managed from the beginning. I mean, we were in full lockdown, and then they've you know they've been very responsive, and they've loosened up, and then we've gone back into it. But there's a lot of local groups that are protesting and want Oregon to reopen.
Yeah, it's very hard when you see, you're obviously working hard, your family's working hard, you're making sacrifices, and then you see other groups that just seem to be deliberately, almost as a point of principle, breaking the rules.
Yeah, and I'm not trying to come across as, I'm feeling sorry for us that we've had to follow these mandates and others aren't. I get it. I know people are hurting, and I know that they're losing their businesses and they need to feed their family. And sometimes those needs rise higher than others. Some pros outweigh other cons. But for me, I can't tell you how difficult it's been for me to be at work in full gear and, look up to the TV of patients watching our national news and see leaders maskless. And it hasn't felt supportive. And we've been at the bedside taking care of these patients and the sickest of the sick and patients that can't discharge because there's all kinds of hangups in getting them to skilled nursing facilities because of the pandemic, delayed discharges, and we've whittled down the patient population in the hospital to the sickest of the sick. It's not normal. It's not a normal nursing year at all in any way, shape, or form. And as new information becomes available, we go with it. It's been really hard sometimes to be the bad guy. You have a patient that's at end of life and families that don't want to, and it's hard. I get it. You've got a loved one dying, but we can't have a whole family gather around at the hospital bed right now. And everyone has had to make really hard sacrifices.
And you've been put in a position where this is something you have to enforce.
We have to enforce. And, this isn't funny. I mean, sometimes it makes me laugh when I think about it, but the grocery store workers, think about them,
Oh, yeah, absolutely. They've been out there every day.
Every day. And they're also having to be in that position to enforce the masks. And, I was talking to one of the guys. So most of the stores, I don't know of any that really don't do this, have someone at the front door that monitors the masks as you come in. And I was asking him how it's going and how that job really is day in and day out. And he said, there have been some situations, people can get really angry. He said one day this guy came to the front door and he said, I'm not wearing a mask. And he shoved his way past, ran into the store, bolted for like aisle 3, grabbed a bottle of hot sauce, threw a $20 bill in the checker's face, and ran off down the street before they could even call the police or anything. But it's like,
why would you do that? It's so tragic. It's funny, isn't it? It's
and the hot sauce. I mean, yeah. So I feel for the grocery store. I mean, I actually was I gave away some of my plants to a fellow that lives in my neighborhood, and he works in the grocery store business, and he was also telling me about how this year has impacted him being in the business. I think that part of it is this year has been hard on everyone in different ways, and everyone's at the end of their rope. And so sometimes people just start with that tension in their voice, and the stress comes out. And
yeah, if there's tension there, that creates tension, and you get a vicious circle, don't you?
And as a professional, you have to be in that role of active listening, and it's exhausting. I hear you. I understand it's hard. You can't visit your mom right now. And so validating constantly, but yet also still having to enforce really hard situations.
And yet you've got to be one that's constantly trying to de-escalate the situation with a soft answer. It's
right.
yeah.
And Oregon's had a tough year. We had political unrest due to the police killing of George Floyd and the racial injustice that came out of that with our protests. We had the wildfires. I had several patients who lost everything on top of a pandemic, everything to their name. And then on top
is that the first time that's happened in your lifetime, Karli, the wildfires, like as bad as that?
I don't remember. I'm a native Oregonian, and I don't remember anything like this until 2017 when we've always had some wildfires. Those are normal, but we got 17 miles down the gorge burned, and that is, a national treasure, the Columbia Gorge, and that was devastating. And then nothing.
The whole ecosystem gone, isn't it?
Yeah, whole ecosystems. And it's when we have so many species that are threatened, and then we already are struggling with habitat degradation, and then on top of that you have these wildfires. It's
so yeah, you could have done without it, isn't it?
Yeah, and then it was the air quality of some of your viewers sent you pictures.
Yeah, we had pictures of that. It was terrible.
It was terrible. And we lost power that week, so we didn't have power, which our house didn't burn down. So I'm not going to complain about the cold showers before work and getting ready in the dark. It was just a par for the course. But the air quality when you had to be outside more in the summer, but then you couldn't be outside, you had to be inside. And you couldn't breathe. Like I couldn't even walk from the garage to my car for work without burning, even with the mask on. It was so bad, so bad.
So you've had the pandemic, you've had the social unrest, you've had the wildfires, you've had all these pretty well borderline intolerable situations at work, and that is accumulatively, you accumulate a lot of tiredness and stress from that, don't you? It's not. Because as you say, it's not an earthquake where you just go flat out for a fortnight, then you're back to normal again. It's just been this constant. Because when we talked on the 22nd of May, Karli, the things weren't actually too bad then. It was just after that the cases in Oregon started picking up, and basically have done so ever since. Is that basically how you've read the year? It's been a gradual increase almost.
It has. I mean,
went down a bit in summer, of course, didn't it? But
yeah, I mean, I think that, it's going to be interesting to see how this plays out. But my feeling is that due to the strong leadership we have here in Oregon with the restrictions, and also the fact that here in Oregon, we have just over 4 million residents, it's, there's like 3 times that in the city of Los Angeles. So we're pretty, we're not stacked up on each other as much as like in other cities here in Portland, but even so, we've had a sharp increase, and it's been really scary to see how full our hospitals are, to see delays in the escalation of care because we don't have an ICU bed or we don't have the staff. It's been scary to see delays in care because patients are hesitant to come in during the pandemic, or there's just not enough space. It's been hard also to see people choose to withdraw care. They choose to withdraw care because they may have made a different decision in a different time. We see all these situations, but I think the one that brings me the most moral distress is when I can't give my patients the care that they deserve because we are so short-staffed or so full and at capacity. When there's a delay in the escalation of care, for example, and you can't get the patient to an ICU bed in a timely manner, I mean, that's something that I hold in, and I struggle with that. It's what you call like moral distress. And
yeah, when you can't say we did everything that was possible, because some things that are possible may not have been done on some occasions.
and I feel for the nurses working in other parts of the country right now. Like Los Angeles has really been on my heart lately, and now I know there are so many other cities I could mention, but I know Los Angeles is really,
it's particularly bad. Yeah.
Now, yes.
Yeah. So there was I was just thinking the restrictions generally, Karli, are people, I mean, we have these ludicrous people that are flaunting the restrictions, but are most people obeying the restrictions most of the time?
I think so. I think most people want to do the right thing. I think that there are, you have to remind people to wear it over their nose. Some people struggle with anxiety and they have a hard time with the mask or whatever. It was really interesting to me, though, over the summer. I took the kids on a series of hikes, and I would say 100% of the people on the hiking trails had either masks in their hand ready to put on when they pass on the trail, and this is outside. And then, unfortunately, though, I think that if we didn't have the mandates in place, we would see a lot less people following them. There came a point in time, and I might have mentioned it back in May, where I saw a shift into it being culturally acceptable, or you would get a frown if you weren't wearing a mask, and people don't want to deal with that. I was talking to my hairdresser, and she said that in the salon they've had problems with people showing up with symptoms or not wanting to wear their mask during the appointment. So again, anyone that works in the community is dealing with exceptions, but I would say, but it doesn't matter, even if you see most. I was actually listening to an interview on Oregon Public Radio a couple days ago, and the mayor of LA, Eric Garcetti, was saying that, and I'll quote him, "If 95% are doing the right thing, it's still a dangerous virus. If 80% are doing the right thing, it could be disastrous." And unfortunately, I think we're seeing the disastrous effects across most of the United States.
And as well as that, it looks like this new variant that was first identified in England is also in the States now. We know it's in Colorado, Florida, California, could well be other places, which of course is going to make the transmission even more rapid. And for a particular level of restrictions that are being followed, you're going to get more transmission. So it means to me that the next few months is going to be quite difficult. I mean, is that how you're reading it? January, February is going to be a difficult time.
It is going to be more difficult. So yesterday, I watched your video yesterday about the rollout of the vaccine in the UK and how the decision's been made to extend the second dose to 12 weeks in order to get more people vaccinated. I'm sure you've seen that's not the decision being made here in the United States.
No.
Dr. Fauci came out yesterday and said, no, we'll stick with the trial data. So what we're looking at right now is the general population won't be getting the vaccine now probably till April here. And that's at least three solid months. Plus we have all of the people that have been infected here over the holidays, New Year's.
And we know maybe 5% of them are going to get quite sick. So, that's inevitably going to happen, isn't it?
Yeah, and we're still in phase 1A, which is healthcare workers and long-term care facilities. I think Israel's already doing 1B phase where they're vaccinating everyone 60 and older.
They're up to about 10% of the population now, I think. It's quite impressive.
Yeah, and I have friends there, and I am so happy to think that my friends there could be getting their vaccine this week. Every single person that I see post their picture, my coworkers, other nurses across the board posting their picture of their vaccine. I am filled with joy. It makes me so happy.
Me too. Yeah.
I feel I've had this fear all year that I wonder if one of my colleagues will get this, right? And so then I know they are now in part protected. Not 100%. And of course, we're going to still wear all of our masks. In fact, a question was asked at a town hall at my work. asked if two people that have had the vaccine, can they get together maskless? And the answer was no, because it's 95% effective even after the second. So 5 to 10% of people, 90 to 95% effective, may not be fully covered. And we also don't know if we could, I don't know. So yes, we're sticking with all the precautions now, and we will be for probably most of this year.
Pleased to hear that, because the Pfizer and the Moderna trials particularly, the outcome of the trial was, were people getting the disease or not? That was what it was looking at. So whether people can still be infectious, whether they can get asymptomatic disease, it isn't entirely clear with the Pfizer and Moderna vaccine. So even though there's theoretical reasons for believing transmission will be reduced, we don't actually know that yet. And you only know that when you collect the data. So that data will be getting collected now as we speak, but as now we don't know. So I'm just really pleased to hear you enforcing that message, that throughout the start of this vaccine campaign, basically nothing changes. We have to carry on behaving exactly as we were. And I think as well as that, even if it were the case that vaccine did somehow stop you from transmitting the disease, if we knew that was the case, we can't really have a situation where, you know, some people were behaving in a particular way and other people are behaving in a particular way. You know, I don't think people will get that. We all have to behave in the same, in exactly the same way. And how long do you see? I see that going on for some time. Do you see that changing anytime soon?
No, I think most of this year. I mean, if we're, I was looking at the Oregon Health Authority's website, and the phases are like phase 1, which is 1A and 1B. 1B is when we can start vaccinating the rest of the healthcare workers and everyone over age of 60. And then it goes to phase 2 and 3. And that we are not going to be able to, the way they're talking, I don't think the general population will be vaccinated before March or April. So, and here in Oregon, we have a fair amount of the population. I don't know the percentage, but there's always been a high percentage of people in Oregon who don't want vaccines. Okay, so and it's just going to be important to get the vaccine to anyone and everyone that would like it, and hopefully we can achieve herd immunity. I hope so by this fall.
Yeah, which is a long time away. We're talking 9 months ahead. You know, it's yeah, it's just the new year now, isn't it? So yeah, the restrictions for the rest of this year, I think, is what you're saying, really.
For sure. And you know, I have my routine dialed down. I get home, nothing comes into the house. There's stuff that I leave at work. Everything gets wiped down before I even come into the house. My husband hands me a robe. All my clothes are taken off in the garage. They're put into a plastic bag, put directly into laundry. My husband hands me the robe, and then it's to the shower. Yeah. And that's been consistently, and that's what most people I know that I work with do as well. We're very careful going home. Nobody wants to bring this home to their family. We have had members of our team test positive. We have had patients on our floor test positive when you don't know. They're asymptomatic, then they turn up positive, and then you have to contact trace. So it's that constant fear. I think that's what came out in the video, and that's not totally gone. It's a constant fear of bringing this home to my family, my friends, harming a patient, exposing a patient. So all of us, if we're being responsible in the healthcare field, are being very careful.
Yeah. But I'm delighted to say you've had the vaccine, and I'm sure many people saw the video you generously shared. What did it feel like getting that vaccine?
I can't even describe to you. I'm kind of glad I filmed that video right after I got to my car, because I couldn't contain my excitement and just I felt so grateful, just overwhelming sense of gratitude, and I'm also a little bit guilty that I would get the vaccine. But I got the vaccine, and so I felt so grateful, so thankful to the science and all of the hard work that went into making those vaccines. So proud of my institution that has rolled this out in such a seamless manner. I feel like as soon as they get the supply, the weekly delivery, they're able to roll it out. And it's just to see the look, because it's all done by appointment based on where you fall in line. So there was a line of people, totally spaced apart. They had the stickers on the floor. It was all like perfectly laid out. There was a room to go for 15 minutes after, just to monitor for anaphylactic reactions that could possibly happen, which are rare. And everything was so well done. Everybody was so happy. And just looking at other people I work with passing me in the hall, knowing that we've been vaccinated. You know, the biggest thing to remember with this is it's protecting our workforce. The people that are taking care of the sick, now our workforce is that much more protected, so we can keep working, because that's part of why we're short-staffed. Is if I have a sore throat, I can't work. It might be nothing, but I have to pretend that it's something to stay home. So
I can't wait to get mine. I just wish it was tonight. You know, it's. How did you feel physically? Sore arm, bit tired the next day? It was the Pfizer vaccine you had, Karli, wasn't it?
I had the Pfizer vaccine. The Pfizer vaccine on December. I was on Christmas Eve, December 24th. I came home that night about 6 hours later. I felt extremely fatigued, like almost I had taken a Benadryl or something. So my eyes were like, I couldn't keep my eyes open, and I fell asleep early. Other than that, I had a sore arm. That was it. The next day I woke up, I felt fine. The drowsiness went away. So I'm planning the second one. The second vaccine is 3 weeks from now. So I was gonna let you know though that we, based on the trial data, my institution is okay to vaccinate between I believe it's 19 and 35 days after. So that's the range they're using to try to stagger it, because there may be more reactions with the second one. So I'm going to get mine in mid-January.
I'm surprised to go as low as 19. I thought they would go for the 21, but
I was a little bit surprised too. And then for the Moderna, which I believe we have a shipment of that now. It's a little bit different range. I can't find it at the moment.
Don't worry, but you're going to get your second dose anyway. That's the policy in the States, that everyone gets the 2 doses.
That's right. Yeah, the Moderna is just a slightly different range. Oh, it's a 25 to 35 day range for Moderna.
25 to 35, right.
Yeah. So regardless of, the UK made a decision. We're gonna roll this out later. The US has made a decision. Whatever the decision is, we need to stick with it and get as many people vaccinated as possible.
Absolutely.
Like,
if we don't have government, we have anarchy. We have to go with the national rules 100%. I think they have applied this to the Pfizer in the UK. I think the evidence base for the longer gap is there with the Oxford AstraZeneca vaccine. I think less so with the Pfizer one. But with the Oxford one, even going back to phase 2 trials, quite a few of the people that were vaccinated, there was a 6-week gap, and they actually found out that it gave an improved efficacy, an improved response. So with the Oxford one, it seems entirely the right thing to do. The Pfizer one, I get the impression that part of the reason they've done that is just kind of to fall into line with the Oxford one, because we start the mass rollout of the Oxford vaccine on Monday, which is the 4th, I think. But the Pfizer's still going. We've delivered about getting on for 1 million in the UK, I think. I think people are a bit disappointed about the slow rollout of the vaccination program in general in the States.
Yeah, and I was listening to this interview, as I said, with the mayor of LA, and he was saying, if we get the supply, we can roll these out. Like, we know how to do this. Having said that, it's the largest vaccine rollout probably in the history of
ever.
Yeah, because so, but they need the supply. But then I hear that the federal government is saying, oh, we've set plenty, and yet they haven't been administered yet. So I know Oregon's got their head on straight with this. They've got a team of people with Oregon Health Authority even ensuring that it's rolled out equitably. So the last thing we want is an inequitable distribution of the vaccine, which is, I think, what you've been talking about with the AstraZeneca vaccine being so affordable.
Yeah, I mean, the Oxford AstraZeneca vaccine is kind of $3 a dose, and what I don't really understand is why I know the FDA are waiting for further trial data carried on large-scale studies in the States, but surely they've got access to the same data that the regulatory authorities in the UK have got access to. They seem to want much more data, and you know, that's a bit of a trade-off, because there's no question that the United States is in an emergency situation now, and I'm personally surprised that they're waiting till, we think, probably April now to roll out the Oxford vaccine, because the United States has booked 300 million doses of the Oxford vaccine. So I'm pretty surprised. Similar situation in Europe. The European Medicines Agency haven't authorized the Oxford vaccine yet, and in Europe they've booked 400 million doses of the Oxford vaccine. So
well, I'm so proud of Israel. They're doing a fabulous job.
Well, is it the Pfizer have got in Israel or the Moderna? Or I think it's just the Pfizer, is it?
I think it's probably just the Pfizer. Yeah, I don't know for sure though. I actually don't.
Yeah, no, I think we can safely predict now that Israel will be the first country to reach herd immunity. And that is going to be, and I'm sure they are collecting thorough amounts of data there, and that is going to be seriously interesting, because you know, all the countries in the world will learn from that. You know, when is herd immunity reached is you know, we know it theoretically. There's a lot of answers to that, but you know, to you actually do it in practice, it's going to be it's good for Israel, because the pandemic will basically go away. But it's going to be interesting as well. A lot of stuff's going to be learned for the rest of the world on that.
It's going to be an interesting year for sure. For sure.
So how do you see things going ahead, Karli? We know the pandemic's going to be with us for a couple of months, but how do you see things in your part of the world, or in the United States generally?
Well, I think it's going to be interesting to see. I honestly, there was a maskless protest at the state capitol yesterday here in Oregon. Some of the people were armed. They did move the protest from the state capitol to the governor's mansion and surrounded it. They want Oregon to reopen. We haven't had the economical support here in the United States like you've seen in other countries, such as Australia. I know the most about, because my in-laws live there.
So this difficulty we see, the suffering we see on the videos, the food banks we see on the videos, that is representing the situation on the ground. That's reality, is it?
From what I gather, well, there's a lot of misinformation out there as well that fuels some of this. It doesn't help when you have a lot of misinformation coming from our national government as well. But people in the, I grew up in the grocery store business. My dad owned a small grocery store. Us kids would get up on Christmas Day. We would go and open the store for Dad. And he always said he had 4 checkers and a box boy. I remember when my dad's second grocery store was in McMinnville, and Walmart moved in and put my dad's second store out of business. I get that people are suffering. It is so hard, and there aren't any easy ways to get through this, especially when we don't have the financial backing coming from our government to help keep things afloat. I've seen so many businesses go under here in Portland, businesses that I have frequented for decades. And they've gone under during the pandemic. And it didn't, like I said earlier, it didn't have to be this way. And I understand, but at the same time, being a healthcare worker and understanding the science behind it, protesting and opening Oregon back up can never be the right answer right now until we have herd immunity. So I just really
Yeah,
plead.
there's just no scientific debate to be had there, is there? I mean, what you say is so obviously correct, you know.
And so there's just no easy answers. People have been so creative though. Like there's a little coffee shop down the road from me that I go to all the time. It's the first place I go. My husband goes and picks it up for me because I'm usually too tired after my work shifts. But they've gotten so creative. And I don't know what their bottom line is right now compared to what it was before. I'm sure it's still not anywhere close, but they've become so creative. And over the summer when we were able to be outside more and like socially distanced picnic tables, local businesses would have these, this particular place I would go to have like pizza with my family, and they would put the bins at the end of the picnic table outside, so you could put all your dishes in there so that the waiters didn't have to touch any of the cups because they weren't allowed to service the table in the same way.
It shows that there's a lot of people understand the transmission now. You know, the stuff that was specialist knowledge now is in the public domain, isn't it? And people are behaving accordingly. What about the vitamin D situation in Oregon and what you've seen? Is there awareness that we don't make vitamin D over winter, that vitamin D is an immunologically important molecule? Is that message getting through?
I think you'll see that it's getting through to people personally who choose to get it over the counter and add it in as a daily supplement. I don't personally see a change in the hospital setting, but my guess is in the outpatient setting, there's been more recommendations. In fact, I will just share for myself. I went in for my annual a couple weeks ago, and my doctor recommended that I take it as a supplement.
Well, that's good, yeah, because I'm looking out your window now. It looks pretty grey.
It is. It's been pouring down rain for several days.
If it's 40 degrees C, which translated into my language is about 10 degrees centigrade, I guess, it's not the sort of weather where you want to expose too much skin outside, is it? It's a
no, yeah, and I think that you saw it prescribed more anyway here in the Pacific Northwest because of that. Remind me, but I think there's even a study out there that shows something about the connection with vitamin D and multiple sclerosis.
Yes, there is indeed. Yeah, we've known for a long time that multiple sclerosis is rarer at the equator, and as you go to the north and the south, the incidence gradually increases. And now, I think basically people are calling multiple sclerosis an autoimmune disease. And we know that vitamin D is an essential immunological modulator. So the two do kind of fit together, and the correlation studies are pretty good. I don't know where we're quite at with causal, but I've certainly heard anecdotal reports that people that have multiple sclerosis who've started taking high levels of vitamin D under the guidance of their doctors have good outcomes from that, and it's certainly one to follow up. It's and so many other conditions, bowel cancer, heart disease, other things like that. I don't know if you want to go into this area, Karli, but we know there's an ethnic divide in the United States in terms of deaths from COVID-19, for example. Is that something that people are quite aware of, that more African Americans, for example, are dying than white Americans?
Yes, the health disparities. I remember even back in nursing school learning about the social determinants of health and political determinants of health. And the pandemic has really exposed these inequities that have always been there. I think the CDC, their data shows that Black Americans are 2.8 times more likely to die of COVID-19 than white or non-Hispanic persons. It's these existing inequities that have stacked the odds in favor of the virus, and comorbidities. There's high blood pressure, obesity, diabetes, more common in those groupings, as indeed is vitamin D deficiency. which is why I was so pleased to see that the Oregon Health Authority has put together something like a 27-member committee to make sure that the virus is distributed equitably.
The vaccine, yeah.
Sorry, what did I say?
Oh, it's okay. You said the virus.
Something else.
I say the wrong thing 10 times a video.
Did I say the virus? No, the vaccine.
Yeah.
So,
no, that's good. Yeah.
Like New York's data, for example, 45 out of every 100,000 white people there died of the coronavirus, compared to 74 of every 100,000 Latino people and 92 out of every 100,000 Black Americans. Tribal communities have also been hit hard.
Have you got a figure for the tribal communities, Karli?
I don't.
But it is high. It's around about the same level as so for 45 for the whites, 74 for the Hispanics, and 96 for African American. Yeah, I mean it is one heck of a difference, isn't it?
Yeah,
it'd be nice. Wouldn't it be nice if vitamin D deficiency could be eliminated? And then we could know that any disparity that was left was other things. It's so frustrating because there's so many variables. It could be vitamin D, it could be the diabetes, it could be the obesity, it could be work related, it could be nutrition related, it could be fetal nutrition related. There's so many things it could be. It would be really nice and good from a health point of view just to start ticking off some of those variables and eradicating them, and then we can target in on the variables that are left and start dealing with those as well, and really start making an impact on this problem.
I'll just read a quote here. This is not because the virus discriminates, Steen Seidlinger, state epidemiologist with the Oregon Public Health Division, told Think Out Loud, which is a program on Oregon Public Radio. It's institutions that discriminate and our society as a whole that discriminates, and this virus has brought that to the forefront. There are things we need to address that we needed to address before this pandemic, but the pandemic is bringing them to light in tragic ways.
Yeah, that's absolutely true. And the other thing, though, I do find to be a problem is you get some people that give very sort of sociological, socioeconomic explanations. You get other people that tend to give very biological explanations, whereas what we need to do is kind of synergize those two and look at the way the socio-cultural economic is impacting on the biological. And I think realizing that we can intervene in both of those domains. It's kind of the way I look at it. Yeah. Karli, that's excellent. Can I just ask you one more question? You mentioned there was people at City Hall with guns. So open carry is legal in Oregon, is it?
It sure is.
But I mean, from a Brit point of view, that just, to see a political opponent walking around with an automatic weapon, I would find that, or semi-automatic weapon, whatever you're allowed to carry, I would find that, well, if they were walking around with a big stick, I would find it pretty intimidating. Never mind, guns. Is it?
Well, you have to remember that a lot of Oregon is rural, and then there's very different cultures as you go across the state. I know when I worked in rural Oregon for a year, the first year I was a nurse, almost everyone I worked with had a gun. They obviously didn't carry it to work, but it was in their homes, and it was definitely a part of the ranching culture there. It's part of the farming culture. People see it as a form of protection. For me personally, I'm not going to say where I stand on it, but for me, I had traumatic experiences with guns in my life, and I get very, very anxious when I know someone has one in my presence. So I would appreciate if people would not have those at the protests. Having said that, we had people in Portland, Oregon being thrown into unmarked vans. We had people being peppered with all kinds of horrible crowd control weapons. And I get why they maybe had decided to go there. But this protest in Salem, again, it's a complicated issue. Is that really what you wanted? Did you want to ask me about?
No, that's fine. It's just a cultural difference, really. In the UK, that would be kind of really weird. I mean, I've worked overseas where guns are commonplace as well. So, but you know, the average Brit would find it strange. Okay, carrying a gun in the woods might be one thing, but carrying a gun in the middle of the city is kind of different. But that's the law in that country. But like you, I guess I've seen what guns can do. I've seen what bullets do when they go through people. You know, and it's not very nice. Yeah, yeah.
You know, and before we the other thing you have to, at least for me, I always health, and I actually have had recently a friend who they did not commit suicide, but they fired the gun in the home due to mental depression while other people were present. And so if anyone, I would say hopefully most people out there that have these guns, they responsibly. And yeah, I just always think about that, them getting into the hands of the wrong person or someone that is really struggling mentally. And, you know, I was looking at suicide rates yesterday, and I don't see, what I have seen online hasn't shown there to be an increase in suicide here in Oregon or in the United States, even over the last year. But definitely people are feeling a lot more mental strain, anxiety, insomnia, you name it. Most of the nurses I work with are not able to sleep at night very well at all. So a lot of anxiety going, especially into our first shifts, not knowing what we're walking into. It's crazy because I went for years getting to work a few minutes before my shift started, walking in, and I feel like in some ways I'm back to where I was when I first started nursing, when I was a new nurse and had to get to work early to sort everything out. That's where we're at right now. You know?
Yep. Well, Karli, I think that's highlighted some fascinating similarities and differences with European culture. I personally find it fascinating. It's infinitely fascinating. So many similarities, but some differences, and it just makes it really interesting. Yeah. Anything else you'd want to tell everyone who's watching, or are we happy with that?
I would just lead with empathy to everyone right now. We're all going through very different experiences, and all of our experiences are valid. Hopefully everyone's trying to do the best that they can, but lead with empathy and just send you and your followers love and strength, and we'll see what this year brings to us.
As I'm sure we all do that to you as well, Karli. Thank you.
I still believe at the end of the day, though, we are in this together. I really feel that.
Yeah, and ultimately it's not over for anyone till it's over for everyone.
Exactly.
Yeah. Karli, thank you. Maybe we should meet up again at the end of this pandemic, and you can give us another update. So,
of course.
But that's twice you've been on this channel now, so it's after the first time, it's really kind of you to come back. So we can talk again if you'd like. Yeah. Okay. Thanks, Karli. Thanks very much. Take care. Bye.